On May 3rd, 2022, I got the call that I had breast cancer. I don't really know how to describe how that feels. I remember sitting in my bed. My husband had took our kids to school, and I was home by myself. I thought maybe I would have got the call when he was there. It was like my life flashed before my eyes a little bit. My first words were, am I gonna die? I don't wanna leave my husband and my kids. Very emotional, very, you have all kind of things run through your head. What are we gonna do? You know, how are we gonna handle this? And Dr. McLeod, who is a wonderful family friend, said, look, we're gonna get you through this. It's not gonna be easy. It's gonna be a lot of work. There's gonna be trying days, but we're gonna get you through this. And he said, I'm gonna connect you with Dr. Hannah Woriax. I'm gonna make you an appointment, and we're gonna start the process. My name is Amanda Hunt, and I will be 37 on Friday, and I am a breast cancer survivor.
Breast cancer screening, I think, has been misrepresented in the media at least for several years, and I'm thankful that recently a couple of the governing bodies that sort of tell primary care physicians and other doctors about how to order screening have changed their stance. For years and years and years before this, encouraged people to start their screening at 40, and that's for people with average risk. Most people in this area actually need to screen before that. It's really important to have a risk assessment conversation with your primary care doc, whether that be your OBGYN, family physician, internal medicine physician, myself, or any of the other surgeons or subspecialists, because we're happy to let you know if something about your family history or your specific breast composition or breast history makes you more high risk than the average patient.
I've been doing the cancer liaison physician for the Cancer Center ever since we were accredited. We're one of 1,500 cancer programs accredited in America, and 80% of the cancer care is given by these centers, so we're very fortunate to be that. Our incidence is pretty much what is along the national lines of 1 in 8 women do get breast cancer, so it is a common, one of our big 4. The other 3 that we treat are colon cancer, rectal cancer, prostate cancer, and lung cancer. So our incidence is about what we see nationally. Men do get breast cancer. 1 in 100 cases is a male breast cancer, and I probably treated in my time here maybe 20 men with breast cancer.
I noticed back in 2017, I had a little lump in my breast, about the size of my thumbnail, and it was kind of sore. About 3 years ago, I had talked to a dermatologist about cutting it out and just getting rid of it, but they said, no, we'll send you over to Dr. Britt and we'll do a biopsy. It's treated very much like a woman. Get a biopsy, decide, that yes, it's cancer. A man that comes up with a new lump in his breast needs to be evaluated, and that usually means getting a mammogram and then a biopsy. And then we talk about the surgery, and most of the time it ends up being we remove the entire breast because the breast is small in a man. So yes, primary care providers need to be aware that men do get breast cancer, and it is not uncommon, and that the man that comes in with a new lump in his breast needs to be evaluated. I would specify, don't ignore your body. If your body's telling you something's wrong, you better get it checked out, because your body don't lie to you.
I will forever be grateful for the treatment that I have received here. I mean, it's been #1. I will tell anybody that Gibson Cancer Center and the doctors here are the best there are in the country. So I'm very thankful.
Each year, UNC Health Southeastern ceremoniously lights a pink ribbon atop its medical center in observance of October as Breast Cancer Awareness Month. The ribbon remains lit throughout the month as a reminder for eligible women to participate in appropriate screenings in the fight against breast cancer.